Life-threatening work hazards at the Salem VA Medical Center prompt yet another investigation by OSHA for a second time this year.
Our years of investigations in the medical center show a continued pattern of complaints that aren't fixed until people working there blow the whistle. 10 News anchor Jenna Zibton is working for you, continuing our exclusive investigations into the latest complaints.
OSHA investigators spent several days at the Salem VA Medical Center in May. Last month, they issued 5 serious violations that they say could result in death or serious harm. Exit doors not marked correctly, doors that don't swing the right way, and electrical hazards. Multiple employees made complaints about the medical center, and an OSHA compliance officer was sent to investigate. They found 4 buildings where doors didn't swing the right way, leading to the outside. Buildings that house the Women's Health Clinic, substance abuse, and mental health. Another building didn't have an exit marked correctly. Other buildings have hazardous conditions with concrete steps that are broken. And the last violations are for electrical hazards that could lead to fires or electrical shock. We took these violations to the Roanoke Deputy Fire Marshal Ronnie Campbell, who pointed to the Station nightclub fire in 2003. Where dozens of people died because of the exits.
You see people that bottleneck up in a door, and a lot of times that's where people perish, is because maybe an inward opening door or just so many people merging at that exit at one time. It just, piles the exit up.
We obtained this email sent by the Salem VA Medical Director, Rebecca Stackhouse. In it, it says, quote, "We had a visit from OSHA related to a concern which had been raised in 2014 regarding some door closures and attic stairs. We fully acknowledge that although we had a good plan in place for correction, the correction to the doors were not completed fully." The email goes on to say, "With your help in reporting issues to your supervisor and with the continued support, we can ensure open communication lines are maintained about projects and other concerns as presented by staff. We can also ensure that items do not fall through the cracks." But other concerns raised earlier this year have fallen through the cracks. A separate investigation 10 News told you about had OSHA involved after complaints of mold and 2 employees reporting health issues. OSHA issued serious violations after an employee didn't get anywhere with their complaint to the Salem VA.
Our perspective is that management was made aware of it some time ago, and there should have been some action taken to fix the situation long before it got to the point that one of the employees had to file a complaint with federal OSHA.
Those mold violations have been fixed. As for the recent violations, we took our findings to the president of the union, representing about 90% of Salem VA employees, Anita Campbell, who walked around with OSHA when they visited. Campbell says she thinks the VA is trying.
It's not going to happen today, and it may not happen tomorrow. The government is a little on the slow side, as we all know, so it takes a process.
The Salem VA had a meeting with OSHA this week to talk about the violations. We asked for someone from the Salem VA to appear on camera. They would not. Instead, they sent us a statement that says, in part, quote, "We recognize that it did take longer than appropriate to correct the progress of these findings due to staff turnover and transition. We are implementing an electronic tracking log to prevent this from occurring in the future." As you can see in these pictures, some of the items were fixed, but they're still waiting on a custom door for one exit. The stairs had some repairs, but not all, because they can't reconstruct stairs in buildings from the 30s and 40s, so they put up warning signs. The Salem VA says they are also looking at other doors and exits throughout the medical center campus to see if other fixes need to be made. They are also doing hazard training with staff. Jenna Zibton, 10 News, working for you.